Do you feel like nothing really works? And are you always fighting erratic blood sugar spikes? What if a simple beverage may reduce your blood sugar levels by as much as 20% after meals? Increase insulin sensitivity by over 19%. Can even lower HbA1c by 0.5% over a period of weeks. The top 4 beverages for diabetes are being revealed today. Each is nutrient-rich and helps maintain stable blood sugar levels while safeguarding your heart, nerves, kidneys, liver, and eyes. These aren't your typical cocktails. They can subtly improve your everyday glucose control and are supported by science. Keep reading, because what you learn might be the secret to more intelligent and simple diabetes management. Let's begin with the first. First, lemon-infused water. What if I told you that a daily silent battle against diabetes might be waged with something as basic as water and lemon? It appears to be typical, doesn't it? However, there is a natural tool hidden behind that fresh squeeze that can alter how your body processes sugar. It can increase insulin sensitivity by 10 to 15% according to studies. In other words, rather than allowing glucose to float in your blood, your cells ultimately open their doors and allow it in. Even a small change like that can lower fasting blood sugar and even lower HbA1c by 0.3 to 0.5%. Yes, those are little figures, but for seniors, they indicate improved vision, reduced renal damage, and less nerve symptoms. Unexpected, isn't it? This is when things start to get interesting. Vitamin C is abundant in lemons. And immunity isn't the only issue here. By acting as a barrier inside your blood vessels, vitamin C reduces inflammation and improves vascular health by almost 20%. Imagine having smoother blood flow and a decreased chance of thrombosis or unexpected cardiac issues. Better yet, consuming lemon water prior to meals reduces the dangerous glucose surges that occur after meals by 15% to 20%. Preventing your pancreas from working too hard and safeguarding your organs. It acts as a silent protector for your skin, kidneys, heart, and nerves, which in diabetics frequently heals more slowly. Here's the catch, though. You can't simply go overboard. It's safe to have 1 or 2 glasses every day. Too much lemon can damage tooth enamel, cause stomach distress, and increase the risk of kidney stones in people with kidney problems. Balance is the trick. While chilled lemon water throughout the day helps avoid dehydration, warm lemon water in the morning stimulates digestion. Additionally, even modest dehydration can cause a 5 to 10% increase in blood sugar, something that most people are unaware of. Second, almond milk without sugar. Although unsweetened almond milk can appear to be just another beverage on the shelves, diabetics find that it has a subtle power. Because it has only 1 gram of carbohydrates per cup and no added sugar, it doesn't create the abrupt rises in blood sugar that ordinary milk or sweetened beverages do. This reduces post-meal sugar spikes by up to 25% and helps the body maintain a more stable fasting glucose level, facilitating the daily management of diabetes. The fact that it promotes insulin resistance adds to its intrigue. According to studies, making the transition to almond milk can increase insulin sensitivity by over 15%. This indicates that the cells in the body react more favorably to insulin and allow glucose to enter without resistance. This small change can lower HbA1c levels by about 0.4% over time. A tiny but significant decline that prevents long-term harm to the kidneys, heart, and nerves. There are advantages to every drink that go well beyond sugar management. By increasing the protective HDL cholesterol and decreasing bad cholesterol by 5 to 10%, its beneficial monounsaturated fats enhance vascular health. For nerve function and to avoid excruciating tingling or numbness, this supports the heart and increases blood flow. A low-phosphorus, low-sodium beverage, such as almond milk, eases the strain on the kidneys, which is particularly crucial because renal issues impact over 40% of diabetics. Its natural vitamin E and calcium fortification, which prevent oxidative stress and maintain stronger bones, even benefits the skin and bones. Here's the twist, though. Almond milk used in excess is not safe. Excess calcium can lead to mineral imbalance, natural goitrogens, and almonds may cause thyroid difficulties. And chemicals like carrageenan, which are present in some products, can create stomach troubles. About 1 cup a day is the recommended dosage. This is sufficient to provide advantages without taxing the body. Vegetable juice comes in third. Vegetable juice may appear to be just a plain glass of liquid, but it can have therapeutic effects for diabetics. Research indicates that frequent consumption of fresh vegetable juice derived from leafy greens, cucumbers, celery, and tomatoes can reduce insulin resistance by almost 15% and increase insulin sensitivity by up to 19%. Additionally, studies indicate that consuming low-sugar veggies on a regular basis can result in a 0.3% to 0.5% decrease in HbA1c during a 12-week period. Vegetable juice helps regulate both fasting blood sugar and post-meal rises by slowing down the release of glucose, in contrast to fruit juice, which produces a sudden surge in blood sugar. Actually, patients who drank vegetable juice as part of their regimen had a 25% decrease in post-meal glucose spikes, which is an important precaution against blood vessel damage. The advantages don't end there. Vegetables' abundant potassium, magnesium, and nitrates enhance vascular health by lowering arterial stiffness by around 12%. This, particularly in those who are susceptible to diabetic neuropathy, directly reduces the risk of heart disease and stroke for the nerves. B vitamins and antioxidants included in vegetable juice slow the growth of nerve damage by nearly 20%. Low-sodium vegetable blends help protect the kidneys by promoting healthy filtration and lowering renal strain. Carotenoids like lutein and zeaxanthin are beneficial to the eyes as well. When taken consistently, they reduce the incidence of diabetic retinopathy by 18%. However, what is the safe amount? It is recommended to consume 6 to 8 ounces of unsalted vegetable juice each day. Consuming excessive amounts of alcohol, particularly when mixed with store-bought juices that are heavy in salt, can raise blood pressure and perhaps overwhelm the kidneys. Excessive usage of sweet vegetables, such as beets or carrots, can also elevate blood sugar levels. The safest option is a well-balanced mixture of greens with a hint of sweetness. Additionally, people on diuretics or blood pressure drugs need to exercise caution because excessive potassium intake from vegetable juice might cause imbalances. Fourth, a drink made with apple cider vinegar. Although apple cider vinegar may appear to be a straightforward, sour beverage, it contains a surprising secret that can subtly improve blood sugar control for diabetics. Just 1 to 2 tablespoons diluted with water, taken before meals, can reduce insulin resistance by around 15% and increase insulin sensitivity by up to 19%. Over time, these modifications may have a significant impact on how your body processes sugar. HbA1c can be lowered by 0.3% to 0.5% with regular use. It might not seem like much, but even minor adjustments might help prevent the unseen harm that diabetes causes. It helps you avoid the harmful highs and lows that put stress on your body every day by slowing down the absorption of glucose, reducing post-meal blood sugar increases by over 20%, and maintaining stable fasting blood glucose levels. This drink's power extends beyond its sugar content. Acetic acid protects your heart and lowers your risk of stroke by relaxing blood vessels, enhancing vascular health, and reducing artery stiffness by roughly 10%. In addition to maintaining blood pressure and supporting kidney function, potassium and magnesium also protect nerve cells and decrease the progression of neuropathy by 15%. As nutrient absorption becomes more effective and enzyme activity increases, the liver and digestive system also gain, and trace minerals subtly boost immunity. Dosage is important. It is safe to take 1 to 2 tablespoons diluted daily. Excessive use can damage tooth enamel, aggravate acid reflux, irritate the esophagus, and increase potassium in people using diuretics. It should never be used undiluted by seniors, and people with kidney issues should exercise caution. This unassuming glass may appear commonplace, but it silently protects your heart, nerves, kidneys, liver, and blood sugar. As such, it is a secret yet effective ally that every diabetic should be aware of. After learning about the top 4 beverages that subtly control blood sugar, let's explore the top 4 protein-rich smoothies that improve your energy levels, insulin sensitivity, and general well-being. 1 is a Greek yogurt and spinach smoothie. There is more to the spinach and Greek yogurt smoothie than just a smooth green beverage. For diabetics, it is a quiet powerhouse. About 10 grams of protein per 100 grams is provided by Greek yogurt, which slows down digestion and reduces blood sugar, increases by 20% after meals. Maintaining stable fasting glucose levels. At 110 milligrams per 100 grams, its calcium fortifies bones, safeguards neurological function, and promotes a stable heartbeat while lowering the danger of arrhythmia. Probiotics, primarily strains of lactobacillus, reduce inflammation in the gut, strengthen the gut-brain link, and increase insulin sensitivity by 18%. Reducing HbA1c by as much as 0.5% with regular use. At 11 per 100 gain, magnesium promotes 300 enzymatic processes, which reduces cramping in the muscles and promotes vascular health. About 3 grams of fiber per cup is added by spinach, which lowers post-meal surges and decreases the absorption of glucose. At 167 milligrams per cup, its potassium balances salt, relieves renal strain, and reduces blood pressure softly. Vitamin K and antioxidants improve arterial flexibility by 12% and protect the heart and blood arteries. Iron reduces weariness and promotes the health of muscles and nerves, while folate improves red blood cell activity and oxygen transport to organs. By protecting the eyes, lutein and zeaxanthin reduce the risk of diabetic retinopathy. Additionally, B vitamins reduce neuropathic pain by 15% by calming nerves. It provides a powerful blend of protein, fiber, minerals, and antioxidants, and is best consumed once a day. However, too much protein and potassium can lead to kidney strain, bloating, and digestive distress. Those who are lactose sensitive ought to select lactose-free yogurt. In order to facilitate digestion, seniors should blend well. The berry almond protein smoothie comes in second. A protein smoothie with berries and almonds is a powerful combination that can subtly change how a diabetic's body processes sugar. With roughly 6 grams of protein per ounce and 76 milligrams of magnesium, almonds help to reduce insulin resistance by 15% and increase insulin sensitivity by almost 20%, helping to gradually lower HbA16 by 0.4%. Their heart is protected and arterial stiffness is reduced by 10% thanks to their good fats. 3 grams of fiber per ounce reduces post-meal blood sugar rises and stabilizes fasting glucose by slowing the absorption of glucose. Potassium relieves kidney strain and aids in maintaining normal blood pressure, while vitamin E fortifies blood vessels and shields nerves from oxidative damage. A cup of berries, such as blackberries, raspberries, and blueberries, has 4 to 5 grams of fiber. As antioxidants, anthocyanins, and polyphenols enhance vascular flexibility and reduce nerve damage by 18%. At 24 milligrams per cup, vitamin C strengthens blood vessel collagen, increases immunity, and aids in diabetic wound healing. Additionally, polyphenols help the liver by promoting detox pathways and reducing fat accumulation. At 0.5 milligrams per cup, manganese helps prevent frailty by strengthening muscles and bones. By adding unsweetened almond milk, you can further stabilize blood sugar, reduce insulin resistance, and get a little boost of energy while also getting 1 gram of protein and 2.5 grams of healthy fat per cup. 200 milligrams of calcium per cup preserves renal function and helps with nerve communication. Together, the nutrients in the beverages promote brain health by improving concentration and lowering weariness, which is frequently brought on by blood sugar fluctuations. The optimal amount is 1 to 1.5 cups per day. Excess protein intake might result in minor renal strain, bloating, and digestive distress. Diabetics with sensitive digestive systems need to watch their fiber intake, and those on potassium-altering drugs should exercise caution. The third is a protein and avocado smoothie. Despite its rather unremarkable appearance, an avocado and protein smoothie can help diabetics manage their blood sugar levels and save almost all of their organs. About 3 grams of fiber from half an avocado reduces post-meal blood sugar rises by over 18% and slows down the absorption of glucose while also stabilizing fasting blood sugar. About 15 grams of its monounsaturated fats reduce insulin resistance by 15% and increase insulin sensitivity by about 20%. Improving the way your cells react to insulin and perhaps reducing your HbA1c by 0.4% to 0.5% over the course of several weeks of consistent consumption. At 485 milligrams, potassium improves vascular health, balances blood pressure, and fortifies renal function, all of which lower the risk of heart disease and stroke. On the other hand, 29 milligrams of magnesium protects nerves and slows the progression of diabetic neuropathy by about 12%. About 20 grams of whey or plant-based protein are added each serving, strengthening muscles, supporting bones, and preventing frailty. Vital for diabetics in their later years. 2 milligrams of vitamin E protects the heart, blood vessels, and nerve cells by acting as an antioxidant. At 60 micrograms, folate increases red blood cell production and liver detoxification. Carotenoids and other phytochemicals have protective benefits on the kidneys, liver, and cardiovascular system by lowering oxidative damage and inflammation. Avocado's healthy fats also improve the absorption of fat-soluble vitamins, such as A, D, E, and K, which increases their advantages for a variety of organs. About 150 milliliters of calcium per meal from additional milk or yogurt helps to strengthen bones and improve heart rhythm and nerve transmission. Yogurt's B vitamins enhance nerve function and lessen tingling or numbness that diabetics frequently experience. The smoothie's antioxidants promote enzyme function and reduce the buildup of liver fat, promoting liver health and metabolism in general. It is best to have 1 cup every day. Consuming too much, particularly more than 2 cups, can lead to weight gain, unsettled stomach, and additional calories that exacerbate insulin resistance. People who are elderly or have kidney problems should watch how much potassium they consume. In order to prevent imbalances, diabetics taking blood thinners or cardiac medicines should exercise caution. By substituting unsweetened milk or water for fruit juice, the benefits are maximized while the sugar content is kept low. Fourth, protein with pumpkin spice. Smoothie. Protein with pumpkin spice. Though it may sound seasonal, smoothies serve as a daily health boost for diabetics, protecting several organs and subtly stabilizing blood sugar. 3 grams of fiber from half a cup of pumpkin puree slows the absorption of glucose, lowering blood sugar increases after meals by about 17% while maintaining steady fasting blood sugar levels. As an antioxidant, its beta-carotene, which is equal to 5,000 IU of vitamin A, protects blood vessels, nerves, and eyes, while reducing the incidence of diabetic retinopathy by roughly 15% compared to normal consumption. Over 300 enzymatic activities are supported by 23 milliliters of magnesium, which directly increases insulin sensitivity by nearly 20% and decreases insulin resistance by about 14%, which, when regularly ingested, may reduce HbA1c by 0.4% in a matter of weeks. Around 20 grams of whey or plant-based protein per serving, 400 milligrams of potassium, which supports heart and kidney health, and 100 milligrams of phosphorus, which fortifies bones and teeth and supports muscular performance, should be included. The smoothie cinnamon has a minor impact on blood sugar regulation, minimizing post-meal increases by about 10%, and enhancing vascular function by lowering arterial stiffness by 8%. 10 milligrams of vitamin C strengthens the immune system and protects nerve cells, while 1 milligram of zinc promotes antioxidant defense throughout the body and helps heal wounds. It is best to consume 1 cup every day. Seniors who have kidney issues should monitor their potassium and magnesium intake since excessive consumption might increase blood sugar, add calories, or produce digestive pain. Utilizing unsweetened water or milk minimizes sugar and optimizes the absorption of nutrients. To avoid electrolyte imbalances, anyone taking diuretics or blood pressure drugs should speak with their doctor. The top 4 protein-rich smoothies were what we fed our bodies. It's time to enjoy the top 4 calming teas that safeguard your organs and naturally balance blood sugar. Green tea is the first. For diabetics, green tea offers more than simply a cool taste. It stabilizes blood sugar and assists almost all organs in a subtle way as a metabolic ally. 2 to 3 cups per day can reduce insulin resistance by about 14% and increase insulin sensitivity by up to 18%, which over weeks may result in a 0.3% to 0.5% drop in HbA1c. Its polyphenols, particularly EGCG, help to stabilize fasting blood glucose levels in the morning and reduce post-meal blood sugar rises by over 20% by slowing the absorption of glucose after meals. Frequent consumption also reduces oxidative stress, safeguarding beta cells in the pancreas and assisting the body in maintaining its natural production of insulin. By lowering LDL cholesterol by roughly 7% and arterial stiffness by 10%, green tea catechins help to promote vascular health for the heart. This lowers cardiovascular risks immediately. About 80 milligrams of potassium per cup helps maintain blood pressure balance and lessens kidney strain, while 20 of magnesium improves nerve conduction and slows the growth of diabetic neuropathy by almost 15%. By protecting liver cells, its antioxidants enhance the performance of enzymes. Additionally, polyphenols maintain the general function of organs by reducing inflammation in joints and arteries. Green tea promotes calcium absorption and lessens oxidative tissue damage, so even muscles and bones gain from it. It is safe and helpful to take 2 to 3 cups every day. Increased use may result in moderate stomach discomfort, sleeplessness, or jitters from caffeine. Excessive consumption may have a minor impact on blood pressure. Because EGG may intensify the effects of medications, seniors with sensitive hearts or those on blood thinners should watch their intake to avoid problems. Lemon improves catechin absorption, increasing the advantages for vascular protection and glycemic regulation. Second, tea with cinnamon. For diabetics, cinnamon tea serves as a silent protector that subtly regulates blood sugar and protects several organs, even though it may only seem like a spicy, comforting beverage. 1 to 2 cups per day can reduce insulin resistance by about 14% and increase insulin sensitivity by up to 17%. It could eventually result in a 0.4%, 0.6% drop in HbA1c. Cinnamaldehyde, its active ingredient, decreases the absorption of carbohydrates, reducing the risk of abrupt blood sugar increases after meals by about 18%. This tea supports natural insulin synthesis and cellular glucose uptake throughout the body, while also promoting better pancreatic signaling and stabilizing fasting blood glucose. Cinnamon tea relaxes blood arteries in the heart, reducing arterial stiffness by 11%. In addition to lowering LDL cholesterol by 6% and maintaining normal blood pressure with 80 milligrams of potassium per cup, antioxidants protect nerves and decrease diabetic neuropathy by nearly 15%. Liver health improves as a result of supported enzymes and decreased hepatic fat formation, which helps detox pathways remain effective while the kidneys undergo less oxidative stress and enhance filtration. Improved nutritional absorption and antioxidant protection boost muscles and bones, and trace elements like zinc and manganese that assist cellular repair help the immune system. 1 to 2 cups per day is the safe amount to consume. Drinking more can cause coumarin, which is found in cassia cinnamon, to produce oral irritation, upset stomach, or increased liver enzymes. Choosing Ceylon cinnamon reduces the dangers while preserving the full benefits for people using blood thinners or liver-damaging drugs. Excessive use may result in nausea, sleepiness, or interactions with sedatives and blood thinners.